good morning friends, and this is another session for the keywords, okay, to make out the diagnosis easily. So here the first question is history of fever, neck rigidity, vomiting, headache and altered sensorium. Okay, so with these clues you can make out it is a meningitis. But here important point, you want to make out the subdural effusion. So if they are given these points, then you can make out it is a Neisseria meningitis. But here the differentiating point is a subdural effusion. So which is the most common complication seen in the Haemophilus influenza. Okay. So whenever you are coming across the term subdural effusion, it is an Haemophilus influenza. Okay. So coming for next question, history of painful genital ulcer which usually bleeds easily and then enlarged lymph nodes. So first it isn't painful, bleeds easily and then enlarged inguinal lymph nodes. In enlarged inguinal lymph nodes, it is nothing but bubo. So whenever you are coming across the term painful genital ulcer, means it is nothing but it is a cancroid which is caused by Haemophilus ducli. Okay. If you are coming across any of the viral cases, like there will be a vesicular lesion, that is a painful ulcer, means it is an HSV. But coming for the bacteria, it is usually it is an Haemophilus ducli which usually causes a cancroid. Okay. So coming for next question is history of fever, profuse sweating, arthralgia, hepatosplenomegaly and unpasteurized milk. It is nothing but brucella. Sorry friends, this question has been repeated. Okay. So as you know, I told you fever, back pain and hepatosplenomegaly and history of an unpasteurized milk. So coming for next question, inflammatory diarrhea and darting motility. So the diarrhea, so there is an one organism in which you will be coming across this term, that is an inflammatory diarrhea, that is Campylobacter jejuni. Okay. So again, you know, it is an it shows in darting motility, and so when you coming across the word what is that inflammatory diarrhea, you can go for Campylobacter jejuni. So as you know, history of peptic ulcer disease or any GERD or any the carcinomas, it is nothing but Helicobacter pylori. Also they can give Avartin stari strain also. Okay, whatever. So coming for next question, history of aerosol from the contaminated air conditioner. Yeah, whenever you are coming across the word air conditioner, it is in Legionella. So the selective medium for Legionella is in bias, buffered charcoal, yeast extract, agar. Okay. So coming for next question, beefy red genital ulcer usually bleeds on touch and then there is a pseudobubo. Yeah, it is nothing but so Klebsiella granulomatis. So here the beefy, that is a term. When you are coming across the word beefy red, that it is like very, it will be very red in color and it is an angry looking like. Okay, so it is a Klebsiella granulomatis. If you come across a history of any cat bite or dog bite, it is nothing but it is a Pasteurella multocida. Okay. So mostly they won't give the species, so just remember the organism Pasteurella. So coming for next question, history of pain dust genital papule which usually gets ulcerated and forms a hard canker. Yeah, it is in syphilis. To be more specific, it is in primary syphilis. So syphilis, right? So it is a painless. So whenever there is a genital ulcer and they have given a history like pain dust, it is in syphilis. So coming for pain dust and wart-like, it is in condyloma lata. Okay, that is usually seen in the secondary syphilis. So next question here is erythema migrans, macular rash or large rash with bullae appearance. It is nothing but it is a Lyme's disease. So the causative organism is in Borrelia burgdorferi. Okay, so you want to remember these terms, that is erythema migrans, they can do. So thank you friends.